Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Wiscott Aldrich Syndrome, or WAS, is a rare genetic disorder. It mainly affects males and weakens the body's immune system. This means the body has a hard time fighting off infections. People with WAS also have problems with bleeding. They may bruise easily or have nosebleeds. Another common symptom is eczema, a skin condition that causes itchy rashes. WAS is a serious condition, but treatments can help. Early diagnosis and care are important for people with WAS. Scientists are always researching new ways to treat and cure WAS. With the right care, people with WAS can live fulfilling lives. Understanding WAS is the first step towards providing better care and support for those affected. It is important to remember that individuals with WAS are just like anyone else, deserving of understanding, compassion, and access to the best possible health care. WAS is caused by a mutation in a specific gene. This gene is located on the X chromosome. The gene is responsible for creating a protein called WASP. WASP helps cells in the immune system communicate with each other. When the WAS gene is mutated, the body doesn't make enough WASP. This malfunctioning communication leads to the symptoms of WAS. Males have one X and one Y chromosome. Females have two X chromosomes. Since males only have one X chromosome, they are more likely to have WAS. If their X chromosome has the mutated gene, they will develop WAS. Females, on the other hand, would need to inherit the mutated gene on both of their X chromosomes to have WAS. This makes it much less common in females. The signs of WAS usually appear in infancy or early childhood. One of the most noticeable signs is easy bruising or bleeding. This can include things like nosebleeds that won't stop, blood in the stool, or tiny red dots on the skin. Children with WAS may also get infections more often than other children. As they get older, individuals with WAS may develop other health problems. These can include autoimmune disorders, where the body's immune system attacks its own tissues. They're also at a higher risk for certain types of cancer, particularly cancers of the blood cells. Section 4. Diagnosis and management of WAS. Diagnosing Wiscott Aldrich Syndrome involves a combination of medical history, physical examination, and laboratory tests. Doctors will look for the characteristic symptoms of WAS, such as bleeding problems, eczema, and recurrent infections. Blood tests can check for a low platelet count, which is a hallmark of WAS. Treatment for WAS usually focuses on managing the symptoms and preventing complications. This may include regular infusions of antibodies to boost the immune system, as well as medications to prevent and treat infections. In some cases, a bone marrow transplant may be recommended. This procedure replaces the faulty bone marrow cells with healthy ones from a donor. Section 5. Living with WAS and future hope. Living with Wiscott Aldrich Syndrome requires careful monitoring and management. Children with WAS need to be extra careful to avoid injuries that could cause bleeding. They may need to avoid contact sports or other activities that put them at risk. Regular checkups with a doctor are essential to monitor for any signs of infection or other complications. Research into new treatments for WAS is ongoing. Gene therapy, which involves replacing the faulty WAS gene with a healthy copy, is a promising area of research. Clinical trials are underway to test the safety and effectiveness of gene therapy for WAS. With continued research and advances in medical technology, there is hope for even better treatments and a brighter future for individuals with WAS.UMCC, your ultimate medical consultant connectors.